think we've had some great information here today, and I'm glad to be here late this afternoon and share just a couple of more things with you. As Matt said, we've got two different tracks of information we're going to cover. The first of those will be pork-specific, but could potentially be something that other industries can also be working on, and we know are working on, again, on exports and how the pork industry will function during an FMD outbreak specific to the export markets. Then we're going to talk a little bit about some vaccine research that the Cross-Species Team did. And I know I'm what stands between you and your fun activities tonight, so we're going to go pretty fast. So hold on to your hats, and we'll go ahead and get started. The first thing I wanted to do was to kind of set the stage when we talk about pork exports and help you all, those of you who may not be as familiar in the pork industry, to understand just the importance of the value of pork exports to our producers and our industry. This is a share of global export markets of pork across the world. You can see U.S. is the leading exporter. This chart shows us volume as well as value of pork products sold into different markets across the country or across the world. And you can see there the change up in order of countries and areas. That is because of the potential to be selling products, traditional products, as opposed to products that are used in other parts of the world, maybe not as much here in the U.S. I think this is really important to understand that for every $1 million of muscle meat exported from the U.S. to our producers on their farm, that means 5 cents per hundredweight. So exports are very critical. And if you look at variety meats, when you talk about $1 million worth of variety meats exported, you're talking about 20 cents per hundredweight at the farm level. So sometimes it's hard to take that back to the farm level, but that's what we were trying to do there. So what happens to our export markets in an FMD outbreak? We heard it many times today. The export markets will immediately close. We understand that. We have some plans that we have built in place to assist with maybe slowing that down or working on the part of reopening those markets. It's important to understand how the entire pork industry crisis plan works then to get into that export market part of the crisis plan. So the U.S. pork industry operates as a joint response team. So the National Pork Producers Council, the National Pork Board, American Association of Swine Veterinarians, and U.S. Meat Export Federation all work together. And we have an umbrella structure. Each stay of that umbrella is part of our crisis plan. So you can see up there, the domestic marketing is right side by side with the export marketing. We're going to focus just on that one stay, just that export marketing for today. And afterwards, I'd be happy to get into any of the rest of those details for any of you. With that in mind, our organizations all have areas of expertise or specialty that we function in. So the Pork Checkoff, the National Pork Board is the Pork Checkoff, the U.S. Meat Export Federation, and the National Pork Producers Council. And as we look at where AASV fits into this, they tie very closely with the Pork Checkoff, and we kind of roll them into the checkoff side of the equation. So each one of those organizations has different specific roles in a crisis, FMD or otherwise, but this is specific to FMD. The Pork Board, the research side, we do research, promotion, and education, acts as the overall structure of the crisis team and provides the science as well as the communications resources to be able to move forward. And then it looks like we get a little bit ahead of ourselves there, but developing the post-crisis communications and trade access maintenance plan. When we say post-crisis, we mean post-day one as opposed to after the crisis. And the Pork Board will work with the domestic trade media as well as the producers in dealing with the situation. But our partner organizations in our trade-specific response, in this case National Pork Producers Council, will do what they do best, functioning with the government officials as the liaison. So you can see there FAS, FSIS, APHIS, U.S. Trade Representative, State Department, in-country consultants, the embassies that are based in D.C. and specifically their ag staff, as well as OIE and Codex. The U.S. Meat Export Federation, then on the other side of the equation, is going to look at product that's in the pipeline. chances are very good there will be product on the seas somewhere. And what do we do with that product? What happens with that product movement? Will it need to come back? Will it be diverted elsewhere? That will be the first aspect that they look at. And then beyond that, they will look at what needs to be done in those countries to maintain the consumer market that has been developed in those other countries. Obviously working with federal officials as well. But functioning as that liaison for their country directors, so in the countries we're trying to export into, as well as their members, many of which are packers, importers, distributors, retailers, the FAS offices in other countries, ATO offices, as well as media and consumer inquiries that come from the countries that we're trying to get our U.S. pork into, or that are waiting for pork that they have ordered and potentially isn't going to be able to be allowed into those countries. The plan in each one of these areas is very, very detailed, and I'm not going to go into every hour of every day, but I just wanted to put up there an example of within the first hour, and this is just what the Pork Board will be doing within the first hour. All three organizations have this detail of a plan for within the first hour, and I think that gets fairly small to the back of the room, so obviously be part of the national industry crisis team, initiate the trade part of the crisis team, make sure that there are message points. First of all, understand what's happening, and then make sure there are message points, distributing those which are domestic message points, but then need to be translated into message points within the countries that those messages will be used for, as well as then going through those different liaisons that we mentioned with the different organizations. So the messages that this group will be working on will be for our trading partners, but also for those in the U.S. trying to get product into those other countries as well. That was within the first hour. The plan details in that kind of detail through the first 48 hours, first 3, first 24, first 48, and then beyond that. Depending on what the crisis is, obviously with FMD, it's going to be an extensive long-term marathon, not a sprint. So the plan goes into much more detail. One of the exciting things that we did last fall was to be able to drill this plan for the industry and focus solely on exports and the trade aspect of it and what we would do with the trade side of the equation. And drills, as the person who coordinates those drills, they're always exciting. It's great to go into a drill. And sometimes when you come out of it, you feel like you're not nearly as organized as you think you are. But that's where we learn and where we can build on that plan more effectively. So that's a quick glimpse at just the pork industry side of it. The exciting thing is that there's a cross-species team that has all of these plans species specific, and that also works to coordinate these plans as an umbrella for the livestock industry. And it's beef, dairy, pork, and lamb. And APHIS is a very critical partner to us on the cross-species team and what we do to coordinate these efforts. This team has been in place since the UK outbreak many decades ago, and it really has been something that has brought together crisis planning in livestock to a whole new level, not just for FMD, even though that's what it's based around, but many of the other situations that are out there, and the ability to assist each other during a challenge or a disease or a crisis in one species. Even though it may be in beef, it certainly affects the pork industry. If it's in pork, it certainly affects the dairy industry as well. So the beef, dairy, pork, and lamb groups working together with APHIS on that. And through that coordination, we look at both communications as well as operations. I was excited to see today that several of the presentations really focus more on the communications side of it. The operations side of it is where many of your backgrounds are, and the exciting part of it. How can we fix the disease, fix the animal, take care of the situation? But that's only part of the battle. We've got to make sure that on the other side of it, that our consumers, whether they're domestic or international, will still purchase our product and still have confidence in the meat and milk supply. And that's really what the cross-species team is trying to do, is to assist with that coordination. We're actually having a drill in DC in about 3 weeks that will, we're calling it a friends and family drill. Initially we had a grandiose plan that we would have several hundred people in for a drill across all the species, and we decided that we needed to scale back our thought process a little bit, and we've got 5 representatives of each species that will be there, as well as government assistance to help us through this drill. And then the next step will be when we put the learnings from that drill into action and then open it up for a much larger drill. So, switching gears from our international trading partners to our domestic consumers. One of the things that we're able to do as a coalition like this is to fund research that we may not be able to do species specifically. So we like to do that to make sure that we're as prepared as we can be for the messaging. A lot of the things that Amy talked about, the ability to understand what's going to happen. We look to research to help us with that as well, especially from a consumer standpoint. Just trying to understand, first of all, the general consumer. Is there an awareness of foot and mouth disease? I pulled out the vaccine-specific set of information here, talking about vaccinations in livestock, an awareness of FMD, and then top-of-mind concerns if there were an FMD outbreak. So the messages that we wanted to understand, or that we wanted to really explore, were consumers' understanding and acceptance of FMD messaging. The last time this was done was in 2007. We just conducted this and finished it up in 2013. And being intimately involved in both sets of research, it shouldn't have been surprising, but it was, in how things have shifted from 2007 to where we are today. Just people wanting to know more information and having access and thinking that they know more about pretty much everything than what they did before. So food safety, disease impact, FMD containment, FMD control, and then finally vaccinations. And I'm only going to go through the vaccination part. The research, and I would be happy to get into the details of it, but we did 3 different rounds: qualitative, quantitative, and then a second set of qualitative, using focus group bulletin boards, using online surveys, and then also using online focus groups that were moderated. The summary, really, the lessons learned: people think they've heard of the disease, but most of them have it confused with hand, foot, and mouth disease. I think that's no shock. That really hasn't changed. People are interested, and they want more detail than we anticipated, and people want reassurance, which means understanding that there is a plan in place, and that plan will protect first them, then their family, and then their pets. And once you get beyond that, they're good to go. The messages, because we did test so many different messages that were most positive or most reassuring to those consumers as part of our focus group, the containment message, and that message is that that USDA and farmers and ranchers are working to contain this disease with the help of their veterinarians, and your meat and milk supply is safe. Tested very, very highly at 52%, being reassured by that, with another 22% being very, very reassured by that. And then as you get into more detail, it drops off a little bit down to the explanation of what foot and mouth disease is. Again, once they know it doesn't impact them, they're out as far as wanting information. So vaccination research specifically, collaboration is crucial, and that means that they want to know that it's not just a farmer or rancher that's working on it, but that there are a number of different agencies and entities working on it, as well as the people who are raising the livestock. Again, more interested than we anticipated, and understanding what has happened elsewhere. The international landscape actually instills confidence here in the U.S. because it exists so many other places in the world, and because meat and milk from vaccinated animals are consumed daily elsewhere. We found that to be very reassuring to our focus groups. The qualitative and quantitative both suggested that consumers don't have a top-of-mind awareness that livestock gets any vaccinations at all. But 55% know that their animals, they know animals are better for being vaccinated when they think about it. So unaided, they don't know that livestock gets vaccination. Aided, it makes sense to them. Consumers believe vaccines are necessary and routine to protect their humans and pets, and thus they carry that out to their livestock. At times that hurts us with that anthropomorphism, but at times it helps us, because if it's okay for my kids to get vaccination, it must be then okay for these vaccinations to exist with livestock as well. But they did express concern about the potential to have something bad from the vaccine carry through into their meat and milk supply. So the need to be able to explain that that's not the case. The quote there is, "I would not mind eating meat and milk from vaccinated animals as long as I know it's safe." Consumers who were aware of routine vaccinations with the procedure makes their meat and milk safer, which we think that is great. That's only 38%. We'd love to see that higher. 1/5, 21%, feel that it makes their meat and milk less safe. We don't much like that number, but we feel like that's where our challenge is going to be, is to raise that number as well. Consumers are reassured by the messages that were tested. Some consumers would likely avoid consuming milk and meat until they knew that the situation was under control. That makes sense. But consumers support vaccinations in the event of an FMD outbreak. That's really reassuring, obviously, because that appears where the disease management is headed. So we just need to make sure that we can develop the right messages and use this testing to be able to deliver those messages in this situation. This is a list of credible sources of information, again, that delivery tool in the event of an outbreak. CDC came in first, and your dark green is very believable, your lighter green is somewhat believable. So CDC has an 85% believability with the general consumer when it comes to disease management. Their own personal health care professionals. So again, that's that personal relationship, 82%. U.S. Surgeon General at 78%, USDA at 75%, veterinary associations at 72%, the chief vet within the state at 70%, and then, not a shock to us in the ag organizations, it drops down to 50%. Obviously they feel like we have a vested interest in what we're trying to communicate with them. But having those other message carriers available and tied into the plan and the information is going to be really critical, and that's why there's so much groundwork going on.
I have a question with this. Do you think the people that you were asking understood what the bottom, I think they would understand what livestock organizations, but do you think they understood what the chief veterinarian of the state or USDA and so forth were?
I think it was probably, I would assume that because it had the word veterinarian in there, that was where the reassurance comes from. Most other research shows that veterinarians are very, very credible. And I would guess that most don't know that there even is one or would need to have any relationship.
I would be surprised if they did. Mm-hmm.
Jim?
Two, I think. Is CDC aware of this, or are they on board? And the second thing is there a plan to get a hold of the healthcare individual doctors, or is that something, at least in our areas, if something happens, we should be sure and call ours to make sure they're aware?
So his questions were about CDC and then your local healthcare professionals. Great questions. We are working with CDC, trying to build them into the plan. both from the cross-species standpoint, the overall umbrella, as well as species-specific. And USDA APHIS has been very helpful in making that connection into CDC and getting to the right folks there. Healthcare professionals, other stays in that umbrella, deal with the healthcare professionals, so that is part of our plan as well. And again, trying to work with them through their national associations, but any time that you can help your local person understand it. And that's why all the materials being available in one place are going to be so critical, so that everybody is speaking with that common voice and has access to that same message.
It's the One Health.
It's the One Health concept. Yeah. So the bottom line, in the event of an FMD outbreak, we need to be assuring consumers that our food is safe and what is being done to contain the outbreak. Again, this is something, as we looked at the research from 2007 until today's research, that really shifted, because consumers, they didn't really want to know about that before. Now they want to know that the outbreak is being contained. Reference trusted and credible organizations and sources, provide resources for additional information. That was really a key point. And some discussions we had before the meeting started today, we talked about the folks who are aggressively information seeking on the internet, but not only seeking, reposting, who then become influencers in their community, their web-based community. And making sure that that additional information is there is really critical. And then integrate in the human element, which was also something, we try to not talk about the economics and not talk about, the producers who are involved in this. That's been a real learning for us in the pork industry from PED, is the story is shifting now to not just about the pigs. Obviously, they're at the forefront, but those people, those humans who are raising those pigs and the impact that PED is having on them, which is a kind of a learning combined with this research, I think that we may want to implement more on the FMD side of things. It may be a day 2 or day 3 story in the situation once we get past your meat and milk supply is safe.